Thanks so much, Casey, and thank you all for joining us today for this key presentation. My name is Priya Penner, and I use she, her pronouns. I am with the partnership, and I am a young, brown, disabled woman with long, curly black hair. Today, I'm wearing a dress, blue dress with flowers on it and daisies, and I am in my apartment. On screen is text that reads, "Disaster preparedness is a key to self-direction." Above this text is the partnership's logo, which is a sun with 4 images within it, and the words, "The Partnership for Inclusive Disaster Strategies," to the right of the sun. The 4 images within the sun are a hurricane, a thunderstorm cloud with a lightning bolt, a house with a split down the middle, and a tornado. The partnership's website, www.disasterstrategies.org, sit to the bottom of the slides. And with me is...
Good to be with you all. My name is Herman Paoli. I am the co-executive director of the partnership. I am a brown-skinned Puerto Rican man with long brown hair tied back. I'm wearing glasses and I'm wearing a turtleneck today. In the background, you see a tapestry, my living room. On screen, you see who we are, the partnership. Partnership for Inclusive Disaster Strategies is the only U.S. disability-led organization with a focused mission on equity for people with disabilities and people with access and functional needs throughout all planning, program, services, and procedures before, during, and after disasters and emergencies. We are your disability and disaster hub. We work with communities on the grounds, making sure that people with disabilities are receiving the services they need before, during, and after disasters.
Let's talk about it. Let's talk about how we are your disability and disaster hub. So first and foremost, we bring together disability leaders, emergency managers, public health officials, and community stakeholders such as yourself. We do this to influence policy, to advocate for the community, and to create systems-wide change. We do this through our daily COVID-19 Disability Rights and Disasters Call, which meet each and every day at 6 p.m. Eastern. We also do this through our weekly national stakeholder calls, which meet every Tuesday at 3 p.m. Eastern. And we encourage you to connect with us. There will be links at the end of this slide, and you will be able to receive the slide deck from Casey. So please do reach out to us. Our emails are also at the end.
Before, during, and after disasters, the partnership leads whole community inclusive emergency management. By whole community, we mean neighborhoods, businesses, government, in disasters, the Red Cross, FEMA, local emergency management. So in the emergency management world, you'll see the term whole community, and people ask, what is that? What does that mean? Another lingo word. It's basically all members in a community, with business, private, and government. In addition, we lead disaster response, disaster recovery, disaster mitigation, and we do this by supporting disabled disaster survivors, their families, and organizations that may be serving them in collaboration and by the leadership and direction of the disabled survivor. We equip communities with equity-focused skills, tools, resources, and relationships. By strengthening community resilience, we do this, we increase the education and awareness on the rights and needs of people with disabilities throughout disasters. We provide technical assistance, training, and we have a vast relationship network with Red Cross, FEMA, other federal partners, and first responders. There's Team Rubicon, the Samaritan Purse, and many others that we have relationships with that in disasters, we help them make sure that they're providing the services that people with disabilities need and are entitled to. By doing these things, the partnership expands disaster readiness and community resilience.
We also provide one of our many response activities include the Disability and Disaster Hotline for support for people with disabilities during disasters. Anyone who identifies as disabled or has a medical condition and needs support during or after a disaster is welcome to call or text 1-800-626-4959 or email hotline@disasterstrategies.org. Please do share this information with your communities because this is a key resource that we provide for our disability community.
And we have operators that speak Spanish and also cite ASL and other sign languages if needed.
Mm-hmm. I want to pause. You may see or hear a kitten who just likes to get into everything. Her name's Maple. She's a tabby and is 7 months old. So appreciate your patience as she runs around and introduces herself to you all. On screen is another way to learn more about us and is a couple of QR codes as well as links below them, hyperlinks in case QR codes are not accessible to you. And again, you will receive these slides after the presentation. The QR code goes to our services catalog as well as our brochures, and they talk more about what services we provide, how we help the community, and how we can partner with you if you're interested in building your community resilience. For today, our objectives are so that you have an understanding of why it's important to create inclusive disaster preparedness and resiliency policies and procedures, some strategies organizations such as yourselves can use to promote disaster preparedness and resiliency in their policies and procedures, and tools organizations can use to promote disaster preparedness for consumers. Jumping right into inclusive disaster preparedness and resiliency policies and procedures. Why are we talking about this in general? Why is it important to talk about preparedness? Why are we bringing it up today? Well, we're talking about it because we know that climate change is happening, simply put, right? We know that humans are causing climate change and that climate change will get worse. The screen shares a quote from the WMO, which is the World Meteorological Organization, and it shares there is a 66% likelihood that the annual average near surface global temperature between 2023 and 2027 will be more than 1.5 degrees Celsius above pre-industrial levels for 1 year. What does this mean? It means that our globe is getting warmer and that the impacts of climate change, therefore, are going to be getting worse. And when disasters are increasing, when climate change is increasing and becoming worse, we know that people with disabilities are 2 to 4 times more likely to die or be injured during a disaster than non-disabled people. We are disproportionately impacted, and yet we are continuously left out of the conversation. That's why it's important to have these conversations. That's why it's important that your organization and that consumers prepare for disasters and emergencies. By having your organizations and consumers prepare, you can help ensure that your organization can continue to provide key services to your consumers, and that consumers themselves can be safer and can maintain their independence before, during, and after a disaster.
Inclusive disaster preparedness policies and procedures can look in different ways. Organizations can prepare by creating and updating emergency preparedness policies. Such policies can include having a policy on doing gap analyses frequently, every couple of years, every 3 years. After 3 years, it needs to be updated just to make sure that things are still as they were in the past, and especially after the pandemic. A gap analysis is a process of analyzing gaps in planning for disasters, emergencies, and all hazards. It looks at your evacuation plans and your shelter in place plans. This is primarily for a place of business. Does it have information on how people are going to shelter in place for an extended period of time? Or do they have kids in each office area? Are those kids updated? Do they have the things that each individual person needs? And everybody understand where are they going to evacuate to in case of an evacuation? There's a building fire, which are very frequent. Where are people? How are people going to evacuate? Where are they going to evacuate to? Is there a destination point near your office where everybody will meet? And is there a person that is in charge of communicating with emergency personnel as that they are called and when they arrive? This is just a beginning parts of a gap analysis, and policies to have a continuity of operations plan, essentially a document that will assess and make recommendations to preserve organizations' continuity of operations during disruptions of operations. Basically, as what if a key personnel wins the lottery and decides to hop on a plane tomorrow to Maui and help after the wildfire there, which is so needed? Who's going to take on afterwards? Are they going? Do people have keys to make sure that things are paid? Wages are paid. That the IT keys are passed on. Who has all this? And is there redundancies to your safety networks? Not just a server on the grounds or two, but how distant from your servers is the backup? These are different things that we look at in continuity of operations plans. It looks at parts of your gap analysis, but the gap analysis is an in-depth look. And disruptions can include to need this, not only disasters, but also public health emergencies. And these are all encompassing. We at the partnership have a focus on the relevant needs of people with disabilities, and this is all type of disabilities. We have areas that look at people with mobility disabilities, cognitive disabilities, sensory disabilities, and developmental and intellectual disabilities. And some encompassing things to focus on can include succession planning, drills and evacuation planning, IT continuity, crisis communication, and working with or working from home agreements and return to work policies. Next slide, please. Thank you, Priya. Organizations should practice their emergency preparedness policies through tabletop exercises at the least, versus a full-scale exercise. Tabletop exercises are discussion-based activities where staff, board, volunteers, and disability community members meet to discuss their roles and responses to a particular emergency situation. Again, mentioned a building fire, having that conversation of how are we going to evacuate? Do we all have the ability to evacuate, or do we need to make mitigation? And we not only count on everyday staff and volunteer that may be at the location, but members of the community, including people with disabilities. How would someone who may be deafblind visiting may understand that there is an evacuation need, and how would that be communicated in a way that doesn't create additional stress than the situation itself, and understand what are the actions to be taken thereafter. And starting by every public meeting that you may have in a physical space, having evacuation directions and shelter in place directions. And that's just the beginning.
This is Priya. I want to add that throughout all of these policies, procedures, etc., it's so, so important that you're engaging disabled folks in the planning, in the exercises, and that, you have input from the community, as that is where you're going to really be able to tell where your gaps are, and where you need to, supplement some planning. I want to pause before we move to disaster planning and preparedness and self-direction. Do we have any questions? There will be time at the end for questions, but I want to pause and make sure that we're giving folks time to process. As Casey shared earlier, you can put your questions in the Q&A feature, using the Q&A feature rather, that can be accessed at the bottom of your Zoom screen. So I'm going to give us about 30 seconds. Seeing no questions in the Q&A feature or chat, I'm gonna keep us rolling here. But please do feel free to put any questions in the Q&A feature, and we'll be sure to pause and go back to them as appropriate. So moving into how disaster planning can look in terms of when self-directing or supporting someone who is self-directing. It's first important to talk about the differences between planning and preparedness. We're using these terms. Sometimes, folks use them interchangeably, but they do represent different parts of the process, right? Disaster planning talks about the process of creating formal strategies and procedures to guide disaster response. And that's what we encourage everyone to do ahead of a disaster, right? And that leads to disaster preparedness, which are the activities and measures taken to ensure that the plans can be effectively executed. When we're talking about planning, it's important to be ready. And what can you do, and what can consumers do to be ready, right? The first is important to know your risks, know what disasters are most prevalent in your areas, and to stay informed, right? And then also know your rights, and encourage your consumers to know their rights as disabled people, and that helps them be able to form an effective plan. When we talk about staying informed, it's vital to follow emergency alerts, Alerts are shared through news broadcasts, the radio, and on social media. You can also sign up for wireless emergency alerts. And then you also can stay informed through the FEMA app or the Red Cross app. And you want to make sure that your fire alarm and carbon monoxide detector in your homes are working and effective. And that's another way to keep yourself safe. Again, it's so important that you and your consumers are making sure to keep yourselves informed and that you're encouraging and creating policies that encourage this planning. When making plans and when becoming ready, you want to have conversations with your support networks, and you want to encourage your communities and your consumers to have conversations with their support networks. Support networks look like family and friends. It can be service providers like those of you in the audience. It can also be places of worship or co-workers. And when you're having these conversations, as Herman mentioned earlier, you want to make sure that you have a plan for sheltering in place. What are you going to do if you can't leave the building? If you can't, leave and you have to stay in one space? Do you have the plans to do so? And what can you do when you need to evacuate? Do you know where you're going to go? Do you know how you're going to get there? Of course, service providers and family and friends are going to be the main basis for support networks. Service providers also includes personal assistance services such as personal care attendants and direct support providers. So that's you guys.
Support decision making in disaster planning for, again, as Priya was saying, those of you the others that are FMS providers or service provider in some way or another, bake into contracts that directly support consumers in creating customized emergency preparedness plans that take into account their specific needs. People tend to say, we get a go back, and then say, everybody needs 1 gallon of water per day and prepare for 3 days. Carrying 3 gallons of water can fill up the backpack, and many of us cannot carry that. So take into consideration what does everyone need and what is also feasible. Many plans recommend, and so do we, in personal kits have extra medication, but many health plans do not allow for this. So talking with consumers and others, how and brainstorm, how can we accomplish the minimum of what do you need to shelter in place and potentially be without someone to assist you for a number of days. And this is not only at home, but in the community, at work, places of worship. If you go out to the bar, because consumers goes out to friends and others' houses, we're at the movies, anything can happen. And do you have something enough to, be comfortable and have what you need for an extended period of time? And surely, when we're speaking about, a shelter in place kit at home, you're at home. You have your cupboards, right? You have where you store anything. But adding to that storage and to what you acquire extra when it's feasible. How are you going to be, in case we saw a lot of sheltering in place during the pandemic, but we could see temporary needed, if there, and hopefully would never happen, But if in a community there's a dirty bomb or a biological weapon happening, how are people informed of putting sheeting tape on their doors and windows, not going out, and having enough supplies not to leave the house for 3 days, for example, or where you work? And how would you not leave? Do you have enough to stay at work for 3 days? And many places don't. And then surely having an evacuation kit, not knowing, and still in the sheltering in place and not knowing where you all may be. But if you are in a earthquake prone area, for example, do you have, like, attached to your bed a flashlight in case something happens at night, and attached to your bed with a string or something, because if there's an earthquake, wherever you had something, it's likely to move away, so that it is in place. And a to-go bag or a go kit that you do have what you need if you need, if there's a house fire, that when such disasters happen, it helps a lot to have your, ID, any deed to the house, or any information that is critical for emergency services. And we all would receive emergency services immediately, but it doesn't always happen without the proper documents. And here, Priya has advanced me to the next slide, which reads, preparedness plans should include emergency kits or supplies, including disability-related equipment, will the consumer need to shelter in place for at least 3 days and maintain independence? If they are power dependent, how will they access power? Important documents. Are the consumer's important documents in one easily accessible place? Are they in a waterproof bag and saved electronically? And are they in a waterproof bag because the power may go out for an extended period of time? There might be no connectivity. And if the power goes out, there are recommendations out there to let your power company know. But it does not, power restoration does not work that way. They prioritize emergency services, so hospitals, police departments, fire departments, other government entities. So if you live near one of these hubs, there's likely that your power will be restored quicker than others. And so that is how power restoration prioritization goes. It is encouraged that people do let their power company know just in case, but we should not expect that just by signing up to a potential power restoration registry that you will be prioritized over what they already have in their planning. And no, go ahead.
I just wanted to ask Herman, we talk about power dependence, and we ask, how will they access power? What are some ways people can start to prepare for if they were to lose power for an extended period of time?
If if experienced, some people often go to a generator. That can be problematic. It is not a sustainable solution. They need frequent maintenance. They need fuel. That they access to going to the gas pump and getting the fuel and bringing it back, and waiting in line sometimes for an hour. We saw that in Puerto Rico after Maria, back in 2017, and that can last weeks on end. That is just one advice to have if you are thinking of a generator, and that the wattage is calculated to the equipment being connected to it, so there's not a overcharge or surcharge. If economics allow, solar battery powered equipment can be another alternative. Oftentimes they run into the thousands of dollars to get a good wattage battery and solar panels to attach to it. These are some alternatives, difficult to come by. Certainly shelters, but sometimes shelters do not have power. So communicating with emergency agencies, emergency management agencies ahead of time, and they are at the county level. Familiarize yourself and let them know that there are people in your communities that need power restoration, that need power after disaster, and asking, does the shelters have a generator? And sometimes yes, and sometimes no. And if there's a generator, is there a second generator in case that one gets damaged at the beginning of the disaster? Is there a plan to bring in a generator to shelters? Do they know where those stashes are? And do they have relationships with fuel companies to continuously fuel the generators? You'll be surprised at how often these nitty-gritty details are not thought about, especially considering how we have seen people needing a vent, for example, and going to a shelter and being told, no, you need to go to a hospital. The hospital was damaged. The hospital is triaging, and just because you need power, you're not triageable, if you will. And knowing that a nursing facility, it's not the best option. And sometimes that is where some people are directed towards. And in disasters, in federally declared disasters, there is oftentimes accompanied by a waiver that will allow a mandatory 3-day hospitalization before someone is relocated to a nursing facility. That is a bad thing. We do not encourage it because just becomes so much more difficult thereafter for people to exit the facilities. And those facilities themselves, if it's a multi-story facility, the first few floors might get assistance, but the higher you go in the floors, oftentimes they're not seen. There's just not enough food or water to take up to the higher floors. And what then? That's just not the proper way to prepare ourselves. There's some examples. I mean, having a plan, thinking through what would happen and how would it be mitigated. And clearly, the best possibility is to evacuate, having friends and families everywhere, where, not just next to you or near you, but that if there is a 3-day warning of a Category 5 hurricane, that you could, go 100 miles away from the area and be welcomed and in a safe space. That can be the best solution. And it's not a solution that everybody can have. Transportation, accessible transportation, and communicating with your social networks. And I think we'll speak more about that in the coming slide. So, and I hope that this helps and that this full presentation helps you all in your personal plans and organizational plans. Talking about communication plans, who within the consumer support network do they want to contact during an emergency, and how will they reach them even if communication is down? And what is the communication plan if the consumer is unable to communicate during a disaster? This is very personalized. We recommend it's included in ISPs in every level. Thinking through how will FMS providers will contact the attendants and the consumers so there is not a gap in pay. Could you incorporate a hazard pay for work happening during a disaster? Is there a waiver to the waiver that would allow for expedited approval of additional hours to prepare for a disaster and in response to? Will there be additional support for transportation in case the traditional transportation is hampered after the disaster. At the beginning of the COVID pandemic, every community had to advocate for personal assistance service providers and direct support professionals to be categorized as essential workers. So they could go into communities that may have, blockages of any sort. And this happens in major disasters as well. Uh, so collaborating with emergency management. So there are badges in prepared, ahead of time so that people can go and support the communities they need to during disasters is critical.
This is prayer. The key to all of this is something Herman just said, doing this ahead of time, working with your communities, working with emergency management before the disaster strikes so that you are ready for when the disaster happens. The best time to plan is before. If a disaster strikes and you're trying to make all of this happen when the disaster is there, it's not going to be effective. Things are going to be lost and people are going to fall through the cracks. We want to make sure these plans and these networks are in place before the disaster happens.
And we've mentioned a number of times, it's good material to memorize that in disaster preparedness, you should be planning for sheltering in place and evacuations. They are very distinct plans. For sheltering in place plans, consider, do consumers have the supplies they need, as well as fun activities to distract themselves if they have to shelter in place? And evacuation plans, how the consumer is going to evacuate if needed, and which routes are they going to take. When you're having these conversations, consider planning for how to and a return to. Will there be transportation to a shelter? And talking through how would the person return and be able to clean out the fridge that now has rotted off many things potentially because the power went out and you were away to clean it out. How would you restore things? And sometimes there is, for those that may be on SNAP or food stamps, for example, there is a DSNAP, disaster SNAP, supplemental program. I used to know what SNAP stood for at one point, but I know it starts with supplemental. That could be SSI. So, but food stamps, there is disaster food stamps, but it doesn't activate quickly always. It is upon the government to ask for these things to the federal government, takes time. So talking through, having a conversation about what does someone need to shelter in place, and that could be at home or in the community, and what do people need to safely evacuate? Where would they be evacuating to? Which direction would they be taking? And is it accessible? Do they need accessible transportation? And discussing it all the way back home and reinstituting all previous services.
This is Priya, just a couple of additions here. Sheltering in place plans, depending on the reason you're sheltering in place and your personal needs when sheltering in place. It might be a good idea to encourage consumers or for yourself to connect with neighbors or folks in your apartment building, as they are the folks who you have most direct contact with if you're not living with anyone else. And they were the ones who may be able to help you if a disaster emergency happens. Yeah, I know for myself, I live alone, and I'm able to do a lot of my own daily living tasks, but if something were to happen, I have plans with my neighbors in case I need to evacuate and need support doing so. I know that, uh, just in general, it's tough to rely on official systems such as uh, emergency services because during a disaster emergency these services are going to be overwhelmed and they're not going to be able to help you directly. We see this happen time and time again, so really being able to plan and rely on people who you have more direct contact with and your community members, those are going to be the folks who are going to be able to help you when a disaster strikes.
Yeah, I think that's towards the end of our presentation. We were asked for a 45-minute presentation and we tried to keep it to it. And please, in the chat, if you don't mind adding reflections, question, comments, ideas that have surged throughout the last 45 minutes.
And on screen is just a thank you slide with our logo at the top. Thank you. And then our contact information. Again, Herman Parodi is the co-executive director. You can reach him at directors@disasterstrategies.org. And of course, my name is Priya Penner. I'm the executive assistant, and you can reach me at priya@disasterstrategies.org. We are so happy to connect with you all and work with you to bolster your own community resilience plans. And, if you're just looking to connect with folks, like-minded folks, you can connect with us for our weekly national stakeholder calls or our daily COVID-19 disability rights and disasters calls, which information for both of those can be found on our website at disasterstrategies.org.